Thank you for tuning in. I'm Min Sun Hee. We start today's broadcast with the live briefing by the headquarters. We'll be back afterwards.
Now, those who are on quarantine is about 1/4 of the confirmed cases. And of the total, we have about 967 imported cases. And among them, 91.6% are Korean nationals. Unfortunately, we had 4 more fatalities from yesterday. And let me now walk you through the regional breakdown of the confirmed cases. Out of the 22 newly confirmed cases, we saw 11 community infections. 4 were reported at Daegu, and in Gyeongbuk we had also 4 people. And nationwide, 81.3% are related to cluster infections. And yesterday, out of the newly imported cases, we have 11 new imported cases, and 7 were from the Americas. And the cluster infections by region is as follows. In Daegu, at the Suseonggu Sarang Hospital, regarding this hospital, from the 11th of April, after one person has been confirmed, we were tracing the contacts, and we confirmed that 2 more people have tested positive, and currently we are carrying out epidemiological surveys. And at the Yecheon-gun County of Gyeongsangbuk-do Province, we found 6 more cases, and a total of 31 reported cases have been witnessed there. And at the Ujeongbu St. Mary's Hospital in Gyeonggi-do Province, 5 more people have been tested positive, and these were those who were on self-quarantine, and the total stands at 69 for this hospital. And us at the headquarters here, we are currently looking at doing the research, and we have analyzing the infectious power of the virus, and we confirmed that out of the testing on 699, we confirmed that 24 have been also being conducted on the research, and we have not yet identified further infections. So aside from the other routes, aside from the droplets, including urine and others, there is a very low risk and danger of infection. And the National Institute on Health, we are also cooperating with the International Vaccine Agency, and we are currently doing the clinical trials on the COVID-19 DNA vaccine. And already starting from 6th of April, the clinical trials are being carried out in the US. And we have been utilizing the candidate compounds. And in Korea, we will conduct the clinical trial number phase 1 and 2. These 1 and 2 phases will be conducted on 40 people. And also going forward, we will conduct testings on clinical trials on 160 more others. And tomorrow, we will also have a pan-government working level task force, which will be newly established starting from tomorrow. And we will conduct our first meeting. And this task force comprises of the heads of the national health and science-related industries, and we will be developing the measures for the vaccine and therapeutics development against COVID-19, and we will also be reviewing the quarantine efforts and measures going forward. And above all, we will be looking at any rooms for improvement for people on the field. So we will provide our support to this end. And up until now, we have been practicing the enhanced social distancing campaign, and we have gone through the early votings at the Easter holidays, as well as the general elections yesterday. This was all possible thanks to all of the public's participation in the enhanced social distancing campaign, and we believe that your efforts are garnering the international attention. Us at the headquarters, we believe that looking at the exposure of the COVID-19 virus very lately. We will be eyeing very closely, considering the incubation period of the virus. We will be able to assess by next week on the further developments of the quarantine aspects. And as we continuously had less than 15 confirmed cases, and yesterday we only had 22 new cases. However, we believe we still cannot put our guards down because very recently we had the first cluster infection in the Yecheon County, and this infection had unidentified infection routes, and this one person spread the virus to about 30 people. So we considering that we had only 22 new cases, when we look at the fact that the infectious rate is over 30%, we believe that we still have high risk of contagion. And moreover, this is setting aside the fact that the cluster infection was not carried out at the high population density places like the metropolitan area. And aside from the Yecheon County case, we also have cluster infections which are continuing and surging. And as you see in other the hospitals and nursing hospitals, we believe that those who are in the high risk category, they still have a higher risk of contagion. So this is of our great concerns, especially for those who are over the age of 65 or those who have chronic illnesses or who are pregnant. These people are the high-risk group, and they can be more fatal to the virus. And thanks to the public's participation in the enhanced social distancing campaign, we were able to curb a further surge in the outbreak, and this contributed to containing the virus to a certain extent here in Korea. However, as mentioned before, whether it be the metropolitan area or any other places, we believe that there is a possibility of a cluster infection in the country. We shall not forget this. And especially if you remember the case, it happened in the middle of February. We need to consider that we need to safeguard the safety and the public health of ourselves as well as our neighbors. And I continue to ask you to participate in social distancing campaign. Thank you very much.
Right, that was the Central Disaster and Safety Countermeasure Headquarters. The briefing began about half an hour early today, hence the early start of our program. We'll turn now to our Kwon Soa for a summary of the briefing and more. Right, Soa?
All right. Well, it looks like the cases have been really stabilizing in recent days. We just heard that the new number of confirmed cases stands at 22. So we can say the cases are stabilizing, but the official right now just said we should not put our guards down because there are cases of new cluster infections as well. And especially he mentioned one of the cases in the Yecheon County where one person it was an unidentified route regarding that person, but that person spread the virus to some 30 people. So still there are risk factors with us. Well, let's take a look at the current updates for today. We have a total number of 10,613 cases now with those 22 added, and 4 people have died from the virus in the span of 24 hours, bringing the death toll to 229, and more than 2,600 people are still in quarantine, while more than 7,700 have recovered. And when we take a look at our map by region, we see that Seoul has 2 new cases, and Gyeonggi-do Province, Gyeongbuk Province, Gyeongsang-buk-do Province that is, and Daegu all have 4 new cases. Busan has 3, and we see 1 in Gangwon-do Province. And most of these cases were related to cluster infections, especially at hospitals. So that is still a big concern. And meanwhile, we have a total of 967 cases from abroad. And today we see 11 new cases were imported cases, with 4 of them detected at the airport due to the strict quarantine measures there.
So I also hear that the government has launched a campaign to express gratitude to the medical staff on the front lines.
Yes, everyone can take part in that campaign through social media, for instance, by expressing their thanks to doctors, nurses, and all the other medical staff that are really fighting against the virus ever since the first breakout we had in January. And during an earlier briefing at the Central Disaster and Safety Countermeasures Headquarters, Vice Health Minister Kim Kang-nip, he held up a board which we should be seeing here right now. And that board that he showed had some words on it. Here we're having that sign there. It says 덕분에, which is Korean, of course, meaning thanks to. And this is a symbol, a sign language gesture. And the hashtags below said thanks to the medical staff, thank you, and we respect you. Also, officials thanked the nation's people who, despite the high voter turnout in the elections yesterday, made sure to abide by the strict quarantine measures. And Korea's elections amid the pandemic can be a great example to other countries. We will focus on that with Adam later on. But today, meanwhile, the second round of online classes will begin, this time for students in first and second grades at middle schools and high schools, and grades 4 to 6 at elementary schools.
Okay, so what about the updates for the rest of the world? I understand the death toll in America is surging.
Yes, the pandemic is far from over in the U.S., although some states and cities that were affected in the earlier stages do see some declines. However, what is really a concern is the overall death toll. It has hit a record high for the second straight day. I'm going to refer to a Reuters tally today, according to which at least 2,371 people died on a Wednesday local time, with a total standing at 30,800. Now, on this table, we're seeing a lower number, but that's because it's the official number from the government. And Reuters noted that it took 38 days to reach 10,000 fatalities since the first death in late February, and only 9 days to 30,000. So that was a big jump. In the meantime, governors of around 20 states with fewer cases appear to be looking forward to reopening their economies. Now, if we take a look at the other numbers, we are seeing that Europe, Spain and Italy are really hard hit places. Also, Germany has more than 130,000 cases, and the death toll in Italy stands now at 21,645. And those are the global updates I have for you.
All right, so thank you for that. Let's turn to you, Aram. I understand that our general elections yesterday were at the center of attention among the members of the foreign media. How did they assess it?
Well, it was a landslide victory for the ruling party, the ruling Democratic Party, just to remind people. And most of these foreign outlets attributed the ruling party's victory to what they thought was the government's effective response to the COVID-19 outbreak. And because the ruling party is associated with the government, they were certainly popular in yesterday's elections. Some outlets assessed that the high turnout was also due to voters being put at ease due to these strict health measures and safety measures in place, as well as voters expressing their views on the virus response through the casting of their ballots. And the BBC, for example, said Korea showed another level of competence by safely holding the election amid the pandemic. It also said the country's citizens were able to blow away concerns of confusion and chaos by casting their ballots in a civilized and cooperative manner. AP noted that it was surprising to see such a high turnout amid the outbreak, because many thought that many people would stay home for the election, but that wasn't the case, apparently. Bloomberg, meanwhile, assessed that the ruling Democratic Party's landslide victory could tempt the leaders of Japan and Singapore and many other countries to carry on with their respective elections despite the outbreak. Singapore, for example, has also been praised for its COVID-19 response, which could spur the government to hold elections to try and get a political advantage. And many other outlets were also full of praise and also surprise over the relatively problem-free election that we had yesterday.
I heard that the last time I checked, some 47 countries have actually postponed their elections. So let's hope that they could maybe benchmark our system.
Of course, and I understand words of praise also came from the U.S. Secretary of State Mike Pompeo.
That's right. Pompeo congratulated South Korea for holding what he called a successful general elections in the midst of the COVID-19 pandemic. In a statement on Wednesday, he said the country is a model for the world. He added that Korea's dedication to democratic values in the face of a global pandemic is a hallmark of a truly free, open and transparent society. He also thanked Seoul for its partnership and its commitment to peace and security in the Indo-Pacific region. Pompeo also thanked Korea for sending 750,000 odd Korean-made coronavirus test kits to the United States. And of course, just to remind people, such testing kits were requested by US President Donald Trump during a phone call with President Moon Jae-in, and they have since been sent to the US after FDA approval. So that's what Pompeo is thanking Korea for.
Right. Meanwhile, staying with President Trump, I understand he's involved in a war of words now with the WHO over his decision to cut funding.
That's right. It has been going, this trading barbs between the two have been going on for this past couple of weeks, and the WHO has hit back at Trump's decision to cut the funding. The WHO chief Tedros Ghebreyesus said he regrets Trump's decision to pull funding for the agency. Here he was on Wednesday speaking and calling for unity.
COVID-19 does not discriminate between rich nations and poor, large nations and small. It does not discriminate between nationalities, ethnicities, or ideologies. Neither do we. This is a time for all of us to be united in our common struggle against a common threat, a dangerous enemy. When we're divided, the virus exploits the cracks between us.
As well as those comments, he also tweeted that the US has been a long-standing and generous friend of the WHO, expressing hope that it will continue to be so. The US is the WHO's biggest donor, with a $400 million donation being paid last year, and the same amount was also earmarked for this year as well. Washington has reportedly given $58 million to the WHO so far this year, but the rest, of course, is now in doubt. The WHO has appealed for more than $1 billion specifically to fund operations to fight COVID-19, but a chunk of that is now missing, of course, after the withdrawal of the funding from the US. The agency says it's reviewing the impact of any withdrawal of US funding, adding it will work with partners to fill any gaps and ensure the WHO's work continues uninterrupted. Washington showed no sign of softening its stance, though. As we mentioned, Secretary of State Mike Pompeo had a comment to say. He pressed his Chinese counterpart on the need for full transparency and information sharing to fight the pandemic. And Trump has also been critical of the WHO, calling it China-centric as well, saying it was too favorable towards China. So I think Pompeo was weighing in on that front.
All right, Adam, thank you for the headlines. We'll see you and So again tomorrow. Now, in this next segment, we turn our focus to India, the world's second most populous nation, as health authorities there brace themselves for a persistent rise in the number of COVID-19 cases amid what is believed to be one of the lowest testing rates in the world. For more on the situation there, we connect live to Ankita Manek, a journalist at First Post of India. Hello, Ankita.
Hi.
Let's begin, Ankita, with the overall situation in India. I understand officials are looking to extend their lockdown.
Just a correction, I'm not with First Post anymore. I'm just
a freelance journalist.
So
then.
I'm a could you repeat your question?
I was wondering what the overall situation was like in India.
So this is the first day of the extended lockdown. We had a 21-day very strict lockdown, and it has been extended for 21 days. So what the government is doing is it's making sure that everybody stays inside. And just because we are, the second most populous country in the world, it's really important for us to stay inside. And we have a really strict lockdown where we don't have public transport in Bombay, and there are no buses, there are no trains running, which is a huge thing because the way Bombay has dealt with other things in the past is even if you look at a flood or a terrorist attack in the past, the city would be up and running in the next 2 hours. this is the first time we have ever seen the city on a standstill. So it's and it's for the best. But yeah.
Right. We'll go into that in a little while. But first, Ankita, I have a question about the reality that during the SARS and MERS outbreaks, India had a relatively low number of infections. Why has the COVID-19 spread so rapidly across the country?
That very interesting fact is since we Indians are traveling a lot, like there are Indians who will travel to, China, Europe for business. We are a very business-heavy economy that's dependent on exports. So that is why everybody has been so careful, because people who have been traveling or have had a history of travel to China, to Europe, there has been a large influx of people there is always a large influx of people coming and going. We also have one of the busiest airports in the world. So that's why I think there has been a large jump in cases here. And
you also mentioned this, but a mass outbreak in India would be especially worrying, as the country is home to the world's second largest population. Are there any specific measures in place to prevent such large-scale infections?
Wearing a mask is compulsory in a few cities like Bombay, Delhi, because these are the biggest cities in India. And for the first time in all of our lifetimes, and I think it will be the only time, public transport has come to a complete standstill. There's no local trains in Bombay. There's no way to get from point A to point B, which makes our lockdown one of the harshest in the world, which is a necessity because because we are such a large number of people, it would be impossible to contain the infection otherwise. And that's why the curve is being flattened relatively.
Ankita, how is the public responding to these stringent measures?
There's a divided response because professionals like me who can afford to work from home or can afford to work from anywhere, we relatively have it easier. But as you must be aware, the migrant labor population, which constitutes a huge number of our population, is facing a huge problem because these are the people who work in the farms. These are people who are now homeless and they don't have they have no way to go home. These are people who are always traveling, people who are always traveling from point A to point B to get work. Now they are stuck in one place without a way to get back to, a place where they can get food or a way to get water. And so the government is trying to provide food and ration for them. But as I said, it's really hard to reach out to the amount of people that we have.
I see. Ankita, which is why I hear there have been reports of attacks against police officers seeking to enforce these lockdowns amid riots involving workers who've lost their jobs because of these lockdowns. How serious are these hostile confrontations?
They're kind of sporadic. There might be one incident that happens in 10 days, but it's because of the sheer poverty that the workers are facing. They have no means to get food or water and they're just stuck, and so it's built up frustration. But now during the second lockdown, we have a few measures in place so that the migrant population is not going to be that affected, and we can make a provision for them. So we are hoping that'll have a better result.
Ankita, I have one final question. I understand that a coronavirus strain identified in India contained a mutation. Can you tell us more about that?
That happened just yesterday. So it might hamper the development of a vaccine, but we don't have a lot of information on that. So I'm guessing that we need more resources and information to know what's going to happen for that.
I see. All right, Ankita, thank you for being with us today. That was Ankita Manak, a freelance journalist live from India.
Thank you.
Meanwhile, here in Korea, the new academic year normally begins in March. But given the COVID-19 pandemic, the fresh academic year began this month. Now, students were divided into 3 groups depending on their grades, and seniors of middle and high school started their online classes last week. Today, the second group of scholars, that would be the first and second graders at middle and high schools, as well as 4th to 6th graders at elementary schools, will begin their virtual learning. We have more in this next video.
This is an elementary school in Seoul.
출석 체크를 해볼 건데요. 민정이 나와주세요. 네, 우리 민정이 왔고요. 시우야.
The voices from the computer speaker fill the empty classroom. The teacher and students meet online instead of face-to-face for a live-streamed Korean language class.
선생님 얼굴도 잘 보여요 라는 친구들은 여기 이렇게 동그라미 표시해 주세요. 동그라미. 선생님도 보이고 선생님 목소리도 잘 들려요.
Among the third graders in the class is Sihu. Unlike middle or high school students, the concept of remote learning is still new to these young students. But they are learning to adjust to the new environment, taking things one step at a time.
네. 자, 시우는 어디를 갔다 오고 나서 썼는지 한번 큰 소리로 발표해 보자.
할머니랑 삼촌이랑 우리 집에 놀러와서 다 같이 가락시장에 가서 새도 사고 꽃게도 사서 맛있게 먹었습니다.
시우는 가락시장에 갔다 왔군요. 굉장히 발표를 잘해 주었는데요.
To help students remain focused on the learning, each class runs only 40 minutes.
아이들이 어려워하는 것은 수업이 끝난 후 저희 반 홈페이지에서 따로 채팅 기능을 이용해서 피드백을 주거나 그리고 아이도 질문을 온라인을 통해서 하는 방법 등 이렇게 운영을 하고 있습니다.
The South Korean school year usually starts in the first week of March, but this year, the Ministry of Education has repeatedly pushed back the start date due to fears over COVID-19. A recent survey found that the majority of parents and teachers feel it is still too early to reopen schools. Amid concerns over student safety and repeated delays to the start of the school year, the Education Ministry decided to open online classes gradually from April 9th, starting with seniors of middle and high schools to April 20th, when classes will begin for all grade levels.
학교의 휴업일을 단순히 1주에서 2주 연장하는 방식보다는 온라인 수업과 등교 출석 수업의 병행을 포함하여 안정적인 등교를 준비하는 것이 지금 상황에서 더 적절하다는 판단을 했다는 점도 말씀드립니다.
The Education Ministry and local governments are lending smart devices to students from lower income brackets, and mobile operators are offering free data access to educational content to facilitate remote learning. When the first round of online classes began on April 9th, nearly 99% of the target students were present. But some of them encountered connection issues because of technical glitches in the system. As the ministry prepared for another opening of classes scheduled for today, it focused on stabilizing the system to accommodate nearly 4 million students connecting to servers at the same time. Schools are leveraging cutting-edge solutions and field-tested tools to ensure students' access to quality education during the COVID-19 crisis.
Now, for more on this new learning approach in light of the pandemic, I have Professor Park Won-gon from Handong University. Welcome, Professor Park.
Thank you.
And Professor Christophe Gaudin from Kookmin University.
Thank you.
Hello, Professor Gaudin. Professor, online classes for elementary, middle, and high school started this month, but those for university students started quite a bit back in March, was it? And I was wondering, how are these students and the faculty of the universities responding to these virtual lectures?
Well, as you can imagine, there's been a period of adjustment. Students never been there, neither have we for the most part. But so far, everybody's been doing their best. The technical infrastructure has worked just fine, but you know, teaching is always a matter of human interaction. And so we miss our students, and hopefully they must be missing us as well. So we all hope to be able to revert back to normal as fast as possible.
Us too, of course. Professor Park, online learning comes with its sets of challenges, as Professor Gaudin has mentioned as well. But surely university students are used to online education. What are your thoughts?
Yes, exactly. Because every universities here in Korea, we have been strongly encouraged by the university that we should have this kind of online class. There is a so-called flipped studies. Probably Professor Gaudin knows that. That's kind of a relatively new method to teach the students. So 1 week we have an online class, and next week we have offline class, so that we can have more time to discuss of this certain subject. So many universities, including ours, have ready to have this kind of online class. But still, there is a lot of room to be improved, because there is technical things and also other human interaction is very important. But see, Korea is a very IT advanced country, so we can be better in future.
Right, and hopefully the learning within the boundaries of a classroom setting will take place in the near future. Meanwhile, do stay with us, professors, because we have more talks coming ahead on the sense of social responsibility here in Korea amid efforts to contain the contagion.
Foreign media outlets have focused on the mature civic consciousness displayed by the South Koreans as they respond to the COVID-19 outbreak. The South Korean government didn't impose any movement restrictions or lockdowns in February when the virus was quickly spreading across the country.
시민 여러분께서도 오늘부터는 외출을 최대한 자제해 주시기 바랍니다.
Citizens practice voluntary social distancing. They kept up with good personal hygiene by wearing masks and washing hands. To help cover face mask shortages, they also shared handmade masks. We take a closer look at the inspiring display of civic awareness and solidarity in the face of a pandemic.
Now, one of the factors that contributed to Korea's robust response to COVID-19 was the high level of civic awareness and voluntary action demonstrated by its people. I have Professor Park Won-gon from Handong University and Professor Christophe Gaudin from Kookmin University to further discuss this commendable characteristic of the citizens here. First, Professor Park. Experts claim that the government has done its part in seeking to contain the contagion so far, and that now it's up to the public to ensure personal hygiene and to refrain from activities that could expose them to possible infection. What are your thoughts on this?
Well, I think the personal hygiene, the guideline is very important. People should follow all the government instruction. But at the same time, I think there is still lots of things to do by the government. Think about that. First, we need to continue to have a very active test. This test is very important. I think this is one of the major factors that Korea is so far successfully calm down the spread of coronavirus. So we have to continue to this very aggressive and active test. And at the same time, when and how open the school, we are already talk about the offline class is important. So should government give this kind of guideline to the university as well as other schools too. And also helping most needy people because of this. We are not the whole shutdown or lockdown, but still many people are suffering by this kind of coronavirus. So government should get more actively involved to helping those people.
I see. Professor Park, unlike the stay-at-home orders or the lockdown measures we heard about in India earlier on the program, Korea simply advised its citizens to abide by social distancing campaign. What are your thoughts on that?
Well, each country have a different situation, so it's very difficult to generalize. But it is true that we are successfully get over this coronavirus. We didn't have any kind of a lockdown or mandatory stay at home. Although we had a very difficult time in Daegu, epicenter of the coronavirus a few weeks ago, people are thinking and considering government itself, considering the mandatory shutdown or lockdown. But the people in Daegu, they are voluntary actually stay at home. I think that's the important point to compare to other countries. We are voluntary, people are voluntary follow this kind of a guideline by the government, although it's not mandatory at all. So that's one of the important factors that we can, so far, and need to be very careful so far to come down this spread the coronavirus.
Professor Gov'T, as a foreigner, what Professor Park just mentioned about the people in Daegu willing to stay at home in light of the pandemic, what are your thoughts on that?
You know, when you tell your friends in France or in the West in general that Korea has been able to manage this pandemic without implementing a total lockdown, people just don't believe it. They don't. Korea has been able to manage this epidemic because on the one hand, it's got a great technical infrastructure. Koreans have been able to produce tests, masks on time. But on the other hand, as you said, as Professor Park said as well, I don't think Korea would have been able to flatten the curve the way it has if it were not for the strengths of social conscience here. You just need to compare the incredible way Korea has been managing elections yesterday and the mayhem of elections that took place in France, in Iran during the last months. All of this is very commendable, but it's not only cultural, it's also very practical, very pragmatic. Koreans see that the way they've been doing has been efficient. They watch the news. They see how bad the situation has gone out of control in the rest of the world. So the public, I think it's well understood in the public that it's no time for Koreans to loosen their effort.
Professor Gov'T, as a political scientist, do you think that there were cultural or social factors in play in ensuring that Koreans stay at home?
Both, I'd say. Some are political, because Korea has been taking the right measures, but even the best measures in the world, such as social distancing, such as tests, such as the masks, they are nothing if the population is not backing them. Decisions need to be implemented. And Koreans so far have been demonstrating first their love for democracy, because they've obeyed their government, but they've also been monitoring that government very closely on social media. That's a huge difference with China. And the result so far, I mean, speaks of itself. Koreans have been demonstrating that they still have very strong communal values, and at the same time that they're able to criticize their government when they think the government is going off track or when the government is not doing enough, as Professor Park said a bit earlier.
Professor Park, some countries like South Africa, Kenya and Uganda have been facing criticism for their tough enforcement of quarantine measures. This balancing of civil liberties and public health, of course, is a challenge for any country. What are your thoughts on this?
Well, actually, China did that too, and one province and one city. And after they break out, they are using this PLA, People's Liberation Army, and to lock down the whole city. And this is a very important issue, and especially it's going to be a very interesting to compare to France, because many people, especially Western people and liberal countries, they are saying that this is invading personal privacy, because we are using some of the GPS data and cellular phones and the CCTV and track down the people's where they were and how and when they were, and then release this information to the public. And that's, I think, is a very effective way to prevent spread, because people know that, well, when I was there and I exposed to that, and then I can go to the doctor and self-quarantine. So there's no doubt that it's a very important issue, important means to deal with this coronavirus, but at the same time, there's another very controversial issue about this invading the personal privacy.
Right, and staying with that, what are your thoughts on that, Professor Godin?
Well, at first, as Professor Pak mentioned, liberal countries in the West first decided not to implement GPS tracing. And now, my home country, for instance, France, facing the incredible violence of the blow the country has had to take, now is turning back to this technique. But unfortunately, for these techniques to be efficient, you need to be able to produce enough tests, because it's useless to monitor people if you don't know who's contagious and who isn't. And you also need to keep the infection under a certain threshold, because you can only monitor a limited number of people. So far what is happening is that liberal countries are moving to this kind of device, but too late. And I'm afraid that for a few weeks, France, Italy, and other Western European countries will have no other solution but to resort to persevering in the lockdowns they've been implementing.
Right.
Actually, China is the most effective country to use this kind of a technology. So our political scientists, we are already naming that is a surveillance authoritarianism. So it's going to be a very important issue among the scholars about how we'll deal this with coronavirus in future.
I see. Professor Park, communities react in different ways in times of crisis, and you have others turning to panic buying. There are still others turning to religious gatherings. But there was no panic buying in Korea. Why?
Well, because first of all, we don't have any mandatory stay at home or lockdown. People are panic because they knew that they are going to have been locked down. So that's why they are going to the store and to have this panic buying. And another important factor is that we have a very good delivery system. Professor Godin probably the experience very interesting here in Korea. We can order using the internet or the telephone easily. So we don't have to store our daily necessity at all. Right. So that's another very important factors.
Which was a very contrast to the scenes we saw overseas. Professor Godin, what are your thoughts about the lack of hoarding here in Korea?
Oh, you know, it's a case of what Americans call, it's a self-fulfilling prophecy. Korea is enjoying a very solid chain of supply. People know they can rely on this chain of supply, as Professor Pak mentioned. And as a result, they don't need to indulge into panic buying. And panic buying is not happening no matter what. You need to trust your own country not to put them under too much of a strain. It's a question of collective intelligence, but also a question, I'd say, I'm not sure Professor Pak would agree with me, but it's a question of collective trust. It's about citizens trusting one another and the capacity of their country to overcome the terrible blow Korea has had to take. Remember, Korea was the first country to be massively infected after China.
That is true. That was a grim reality for us. Now, staying with the idea of collective trust, let's go into these collective efforts to ease the burden on each other. We've had the so-called good consumption campaign where landlords either they froze or they lowered rents to ease the financial burden on small businesses. What are your thoughts on this, Professor Park?
Well, we have a lot of this kind of experience. I remember that back in the year 1997, we have a financial crisis, so-called IMF International Monetary Fund era. And those time of period, people have a voluntary movement to gather the gold to pay back all the debts to the IMF. So those kind of movement happen when we face this kind of crisis and emergency. So this time we gathered together and in order to overcome this kind of difficulty. Korean public is very passionate. So if we have the right appropriate motivation, we gather together and we have a very dynamic society.
Professor Park, we held our general elections yesterday at the height of the COVID-19 outbreak, and the voter turnout was very high. What do you make of this?
Well, I saw the report. We have a very, good kind of a mechanism to protect each and every voters. I have the experience to have of course, that's my right to cast a vote. So I have a very strong eager to go there. But if we don't have this kind of a protecting measure, I'm the political scientist, just put the emphasis on this voting right, but still I'm probably reluctant or thinking twice whether I go there or not. But I believe this kind of trust, this protecting measure, so that's why many people participate this congressional election.
And I'm assuming you were there as well yesterday to vote.
Yes.
Professor Godin, you mentioned the commendable way we held our election yesterday. What other message would you like to share with our viewers or the viewers back in France with regard to efforts as such by Korea amid the pandemic?
Two things, mostly. First, it may look like a very basic takeover, but this epidemic has showed us that politics matter. Some countries have been able to take the blow, others haven't. And Korea has been able to take the right measures at the right time, producing tests, saving their industry, preserving their healthcare. The Western Europe has not been able to do so, and right now we're paying a very high price in human lives. So that's the first point. The second point is the importance of social conscience, collective intelligence, and the way Koreans have been able to comply with the norms edicted by their government, but also to monitor them. There will be, as Professor Park said earlier, one of the main questions we will have to face in the future as political scientists, but also as citizens, it will be about these GPS tracing techniques, how to monitor them, how to manage them. It will be a very hard time for democracy, I fear.
Right, and hopefully we'll have an answer in the future then. All right, Professor Godin, thank you for your thoughts. Professor Park, as always, thank you for being with us.
Thank you.
Well, that is all the time we have for today. We'll be back tomorrow with a look at the consequences of self-quarantine violations. In the meantime, do share your thoughts and inquiries through our social media accounts or homepage, arirang.com. Thank you for being with us.